Femoral artery. Femoral artery is the chief artery of the lower limb and it originates as a continuation of the external iliac artery. It begins behind the inguinal ligament from the mid-inguinal point. The extent and the course of the artery is as follows. It passes downward and medially and it first enters into the femoral triangle and then continues into the adductor canal. At the lower end of the adductor canal, at the junction and at the mid and the lower third of the thigh, it passes to the adductor magnus via opening and that becomes continuous into the popliteal artery. Relations of femoral artery in femoral triangle. Anteriorly, it is covered by skin, superficial fascia, deep fascia, and anterior wall of the femoral sheath. Posteriorly, there are muscles which covers the artery, that is psoas major, pectineus, adductor longus, and posterior wall of the femoral sheath. Medially, it is bound by femoral vein, that is medial to the artery in prior or in the upper part, whereas this vein get gradually crossed to the lateral side and in goes to the posterior side while moving to the apex. Laterally, the femoral artery is bound by the femoral nerve, which is lateral to the artery, and lower down, the nerve get divided into multiple branches. This is a diagrammatic representation of the femoral triangle. Firstly, the artery. This is the femoral artery, which originates at the mid-inguinal point in the inguinal ligament. It is a continuation of external iliac artery into the lower limb. It gives multiple branches in the femoral triangle, that is 6 in number. Now, medial to the femoral artery is femoral vein and lateral to the femoral artery is femoral nerve. In the upper part, this particular femoral nerve is a hole. While moving downward, it gets divided into multiple branches which sides lateral to the femoral artery. Now, medial to the femoral artery is femoral vein, which is in the upper part, medial to it, and in the lower part, it goes posterior to the femoral artery. Let's study the branches of the femoral artery in the femoral triangle. There are 6 branches of femoral artery. 3 are superficial and 3 are deep. So the first 3 superficial are superficial external pudendal artery, superficial epigastric artery, and superficial circumflex femoral artery. Superficial circumflex iliac artery. Now the 3 deep artery are profunda femoris artery, deep external pudendal artery, and muscular branches. Let's study these branches in a brief detail. First is superficial external pudendal artery, which supplies to the skin over the external genital organs. Then there is superficial epigastric artery, which supplies to the skin, superficial fascia over their skin, and the anterior wall of the abdomen. Then there is superficial circumflex iliac artery, which supplies to the skin over the iliac crest. Then there are 3 deep branches. First is profunda femoris artery, that is the main branch of the femoris artery. Let's study profunda femoris artery in a detail. It is the largest branch of the femoral artery and it is the chief artery which supplies all the 3 compartments of the thigh. It arises from the lateral side of the femoral artery, that is 4 cm below the inguinal ligament, and its origins lies in front of the iliacus muscle. It is posterior to the femoral vessel and descends downward while moving posterior to it. Now it leaves the femoral triangle, bypasses continuous with the adductor longus, and it is continuous downward. Firstly, it passes between adductor longus and adductor brevis. Then it is between the 2 muscles, that is adductor longus and adductor magnus. The termination of this muscle, this artery, gives as anastomosis with the upper muscular branch of the popliteal artery. At the profunda femoris artery gives multiple branches. They are as follows. Profunda femoris artery first give medial, circumflex femoral artery and lateral circumflex femoral artery. Here, the medial circumflex femoral artery, which again gives ascending and transverse branches, whereas the lateral circumflex femoral artery that gives ascending, descending, and transverse branches. The second is deep external pudendal artery, which supplies the spermatic cord of scrotum in males and round ligament of uterus in female. Also, it supplies to labia majora in females. Now, it gives multiple muscular branches, and this multiple muscular branches supplies to the muscles of the skin. It supplies to the muscles of the thigh and skin over it. Clinical anatomy of femoral artery. It can be pulsated or palpated at the mid-inguinal point against the head of the femur and the tendon of the psoas major muscle. Second is the compression of the femoral artery at the mid-inguinal point against the head of the femur can be used to suppress the bleeding at the lower or the distal part of the leg and the thigh. Now, the femoral artery is quite superficial in the femoral triangle. Therefore, it can be easily exposed for the ligation during heart surgeries. Femoral vein, which is used for the intravenous infusions in infants and in the patients with the peripheral circulatory failure. That's all for femoral artery.